following program contains the opinions of its host and guests, not those of this network. The opinions expressed are for non-commercial informational purposes only. Listeners are cautioned not to rely on program content to treat or prevent disease, but are advised to consult with a licensed healthcare professional where they live for diagnosis and treatment of disease.
And now, the superstar of alternative health and purveyor of medical truth, Dr. Joel Wallach.
Hello and welcome to Dead Doctors Don't Lie. Dr. Joel Wallach, your host, a veterinarian and physician. And I'm here for kids and baby boomers and seniors who don't want to die at 75.5 like their parents and grandparents. I'm here for kids and baby boomers and seniors who don't want to be sick and miserable for the last 15 to 20 years of their life like their parents and grandparents. I am a conservative. A lot of people say I treat them like dogs, but they do seem to get better. Now, if you have a personal health challenge you want to ask about, either the health challenge of a friend, a loved one, a workmate, or if you want to talk about medical politics or the home-based business opportunity, give us a call toll-free, 1-888-379-2552. Again, that's toll-free, 1-888-379-2552. We can't get away from these pre-existing conditions because President Trump is insisting that the Senate deal with the health care thing before they move on to tax problems and those sorts of things. And so we're going to keep hammering away at this because we can prevent pre-existing conditions, and most of them, except for many birth defects, but most of the pre-existing conditions that an adult will acquire in adult life are totally reversible. We're talking about stroke and atrial fibrillation and, dementia. What about artery disease of all kinds? And then, of course, and bypasses and stents and all that kind of stuff. And then kidney failure, kidney disease. We're talking about dialysis. What is going on here? Well, I'm going to say that kidney dialysis, artery disease, and stroke are kind of all in the same basket. When you eat inflammatory foods, they cause inflammation in the lining of the arteries, the intima, the lining of the arteries, and you wind up getting a plaque, which is a mixture of scar tissue and blood clots and stuff like that. The plaques in the arteries are not due to things like consuming cholesterol, bad cholesterol, and consuming saturated fat and these sorts of things. That was all a failed theory, okay? And so what is the cause? Well, eating inflammatory foods. Again, we're talking about fried foods, processed meats. We're looking at deli slices, sandwich meat, sausage, ham, bacon, bologna, salami, pastrami, pepperoni, jerky, corned beef, spam. Smoking, those things inflame the arteries, and eating a lot of oils. People say, oils? Everybody tells me oil is good for me. No. Olive oil, coconut oil, margarine, mayonnaise, and cooking oils, these things all oxidize, turn into trans fats, heterocyclamines, and acrylamides, all of which cause inflammation in all tissues of the body, particularly in the lining of the arteries, and again, you wind up with plaque. It has nothing to do with cholesterol and saturated fat. That was a failed theory. Now, how does this deal with the stroke? Well, you can get in this rough area inside the artery that's inflamed. If you're deficient in a single nutrient, and there's one nutrient deficient, you're going to wind up with a blood clot. It's caused by deficiency of a single nutrient, blood clots, pulmonary embolism, a blood clot in the lung, thrombotic stroke where you get a blood clot in the brain, coronary thrombosis where you get a blood clot in the coronary artery, deep vein thrombosis, you get a blood clot in a vein in your legs. And these are things that are all caused by deficiency of a single nutrient. And, of course, if you have inflammation in your blood vessels, that will aggravate it. Now, so what does kidney dialysis have to do with artery disease? When you have kidney failure, there's nothing wrong with your kidneys. I'm going to back up a minute here and say it again. When you have kidney failure, 99% of the time there's nothing wrong with your kidneys, but you do have plaque in the arteries, and so you have obstructive artery disease. That includes the little arteries that carry the dirty blood into the filtering units in the kidney. And so your blood test will show that your kidneys are not filtering the blood. You're still getting a lot of dirty stuff floating around in the blood because your kidneys aren't filtering that. But that's not because there's anything wrong with the kidney. Well, that's what the doctors say. What's happening here is the dirty blood is not getting to the filtering units. Now we have a different problem. So what do we do for plaque in the arteries, in the brain, the heart, the kidneys? I don't care if you haven't urinated in 10 years. You're on dialysis 6 days a week. Doctors say you're not a good candidate for a kidney transplant. Well, you get off all the inflammatory foods. Again, no fried food, no processed meats with nitrates and nitrites, no oils, no gluten, no wheat, butter, and oats to increase the efficiency of absorption of nutrients and help reduce the inflammation. Okay? And then I'm going to take the 90 essential nutrients, 16 minerals, 16 vitamins, 12 amino acids, 3 fatty acids, and we actually have programs. We have pre-existing programs. The basic program that everybody requires, all vertebrates, whether you're a hummingbird or a flamingo or an elephant or a human being, a rabbit, a turtle or a fish, doesn't matter. All vertebrates require the 90 essential nutrients, 16 minerals, 16 vitamins, 12 amino acids, 3 fatty acids. And then, so we have what we call the Healthy Start Pack, one of those per 100 pounds of body weight. And then you throw in what we call the Ultimate Daily Classic Tablets. Ultimate Daily Classic Tablets, they're designed to support healthy blood pressure. They're designed to support healthy blood flow through blocked arteries. And for 100 pounds, you take 3 of those twice a day. And, of course, that would amount to 2 bottles a month. For if you weigh 100 pounds, if you weigh 200 pounds, I'd go ahead with 9 a day, 3 at breakfast, 3 at lunch, 3 at dinner. That'll be 2 bottles a month. And get a hold of the books, Dead Doctors Don't Lie, Epigenetics, The Death of the Genetic Disease Transmission, the book Rare Earth Cures, and get a hold of the CDs. Get a hold of the CDs and the DVDs, Dead Doctors Don't Lie. Get a hold of the DVD and the CD. DVD, Somebody Needs to Go to Jail. The CD is Public Enemy Number 1. And then, of course, my newest CD is A Stick of Butter a Day Keeps the Doctor Away. Because if you're not eating healthy, complete dairy fats, you increase your risk of Parkinson's disease, MS, Lou Gehrig's disease, and Huntington's disease. You increase your risk if you do not eat dairy fat. There was a big study that just came out. 128,000 people in the study, and the ones that had a high intake of dairy fats didn't have any of the Parkinson's disease. And the ones who did not eat dairy fat had the high rate of Parkinson's disease and MS and Lou Gehrig's disease and so on. So I urge everybody to take their 90 essential nutrients. Again, 60 minerals, 16 vitamins, 12 amino acids, 3 fatty acids. Get a hold of the Healthy Brain and Heart Pack and throw in the Ultimate Daily Classic Tablets. And you're going to have all the nutrients necessary to support healthy metabolism, healthy replacement of the cells that are dying in your tissues and organs every day. Everybody knows your skin goes away, and then you rebuild it all the time. Well, that's true of all of your tissues and organs in your body. But your genes, DNA, RNA, and telomeres require the 90 essential nutrients to pull it off. Contact your NZ associate with the books, Dead Doctors Don't Lie, Epigenetics, Rare Earth Cures, and we'll be back with Dead Doctors Don't Lie for these messages.
You're listening to Dead Doctors Don't Lie on the ZBS Radio Network with your host, Dr. Joel Wallach. If you'd like to talk to Dr. Wallach, call us on the toll-free line at 888-379-2552, on the priority line at 831-685-1080. Aromatherapy oils have been prized by ancient cultures for thousands of years. Longevity's ancient legacy, true aromatherapy, is no exception. Essential oils are the fragrant life essence from plants that are gently removed through the process of steam distillation. Longevity's ancient legacy essential oils are of the purest concentrations from the most respected and ethical distillers worldwide. Many ancient legacy oils come directly from families in the East which have been distilling essential oils for over 100 years. Keep Ancient Legacy's tea tree oil in your medicine chest for first aid. Tea tree oil is great for soothing the itching and stinging associated with insect bites, burns, scrapes, and other skin irritations. It's also effective as an antiseptic. To learn more about aromatherapy and essential oils, contact your local Longevity associate today. And don't forget to ask about business opportunities.
Hello, Judy DeVilbus here. If I could only afford to get one product out of everything, that product would be the Ultimate Classic. It has the vitamins, the minerals, the bioflavonoids. It even has grapeseed extract. The one product that would give you just about everything under the sun you would need for a perfect nutritional program would be the Ultimate Classic. By the way, people that are on the go, it's very, very hard to take the liquids with them when they go on their trip to get their supplements in every day. Well, you know something? You can use the Ultimate Daily Tablets and the mineral capsules. When I'm going on a trip, if I have enough room, I just take the 2 bottles with me. If not, just use a little baggie and take a couple of daily doses with you. It's very simple. It's very easy. There's no mess, no fuss, no refrigeration. Just take your capsules, take your tablets, and you're finished for the day.
To order these products, call your local Longevity distributor today.
We're back with Dead Doctors Don't Lie on the ZBS Radio Network. Dr. Joel Wallach here for Longevity and the 90 for Life Crusade. We do have lines open. Give us a call toll-free, 1-888-379-2552. Again, that's toll-free, 1-888-379-2552. And if you're going to do the longevity business as a business, I'd urge you to get a hold of that trilogy of books, Let's Play Doctor, Let's Play Herbal Doctor, Passport Aromatherapy, and learn how to deal with over 900 different diseases using vitamins and minerals and trace minerals and rare earths, amino acids, fatty acids, herbs, and aromatherapy oils. It's a trilogy of books, Let's Play Doctor, Let's Play Herbal Doctor, and the Passport Aromatherapy. If you've never owned your own business before, if you've never run somebody else's business, get a hold of the book Wall Street for Kids and learn how to deal with being profitable and also how to get all the tax breaks that billionaires get. That's what I like, is all the tax breaks. We don't want to take away the tax breaks of billionaires. We want to just get the tax breaks of billionaires. Only stupid people pay taxes unnecessarily. Okay, Doug, what pearls of wisdom do you have for us today?
Well, I thought we'd talk a little bit about antibiotics, as I have a Fox News story here, headline, Do You Really Need to Take All Those Antibiotics? And they say there was a recent article in the British Medical Journal that set up a bit of a firestorm that claimed the antibiotic course has had its day. The authors challenged the very widespread belief that you should keep taking every last dose of antibiotic prescribed by your physician, even after you feel better. The challenge to that claim was sparked a backlash with physicians and public health officials expressing concern that an overlying complex message that could result in encouraging patients to go rogue and ignore their doctor's prescriptions, which is probably a good thing. But they say historically doctors and parents have, and patients that is, have both been pretty dreadful about using antibiotics appropriately. We've long prescribed antibiotics out of fear and habit, not science. As far back as 1945, Alexander Fleming, the man who discovered penicillin in 1928, warned the public that people taking penicillin to treat diseases not caused by bacteria, and that this unnecessary use of penicillin was going to breed out antibiotic resistance, warning that those who abused penicillin would be morally responsible for the deaths that ensued from penicillin-resistant infections, and he was right. The sad thing is society never did listen, and this all comes from Brad Spellberg, a chief medical officer at L.A. County in Los Angeles. He said it's been estimated that 30 to 50% of antibiotic use in the U.S. is unnecessary, in his opinion. He says those numbers are hilariously low. He estimates 75% of or more antibiotic use is unnecessary. And the truth is, they say we don't know how long the course of antibiotics is necessary to treat most types of infections. Even in the modern scientific era, primary basis for the duration of most courses of antibiotics is a decree Constantine the Great issued in AD 321 that a week would consist of 7 days. That's why your doctor gives you 7 or 14 days of antibiotics. I found that sort of interesting, that it goes that far back. And in the last 2 decades, we've actually had dozens of clinical trials published demonstrating that shorter courses of antibiotics are just as effective as longer courses. Furthermore, the shorter course regimens led to lower rates of antibiotic resistance. So there you go. This Alexander Fleming was right way back in 1945.
You're exactly right. And, of course, when doctors don't know what you got, they'll prescribe an antibiotic so you think that they're doing something good for you. Oh, he knows what to do, and he's giving me an antibiotic. Now, I run into this all the time. You hear this on the radio, too. Shar hears this all over the place. That people say, well, I've been on antibiotics every day for 25 years for UTIs, urinary tract infections. What? For 25 years? You have a back problem? Yeah. I said, well, your back problem is causing your burning on urination. You don't have a UTI. You don't have a urinary tract infection for 25 years. Then another one I get a lot, and Shar hears this and you hear this, is that, oh, I've had chronic Lyme's disease for 25 years. I've been on antibiotics for Lyme's disease for 25 years. The doctor doesn't know what you have. Probably just have a gluten intolerance, and he says you have Lyme's disease to make you think you got something exotic. And he gets a kickback every time he writes a prescription for those antibiotics for 25 years. Okay, and of course, you wind up when you really need them, you can't use them because every bug in your body is antibiotic resistance. And people are being used as an ATM machine by the doctors. And, of course, that's happening with all this opioid stuff. And, of course, we got to sue the pharmaceutical companies. Well, they did that with cigarettes. They sued the cigarette companies, but who is prescribing cigarettes as a treatment for depression? Medical doctors. They had the most advertisement of cigarettes in medical journals of any other publications in the world. And doctors never got sued for lung cancer. They should start getting sued for that. Thank you for bringing those things up, Doug. We'll be back after these messages.
You're listening to Dead Doctors Don't Lie on the ZBS Radio Network with your host, Dr. Joel Wallach. If you'd like to talk to Dr. Wallach, call between noon and 1 Pacific at 831-685-1080, toll free 888-379-2552. Many believe that all life began in the Earth's oceans. We do know that the oceans and seas are still abundant with life and life-sustaining nutrients. Many cultures have long believed in the life-giving properties of plants and sea life harvested from the oceans. Youngevity's Ocean's Gold is a proprietary blend of seaweeds, algae, mosses, kelp, sea cucumbers, and sea minerals, as well as coenzyme Q10, calcium, and iron, all designed to help support healthy thyroid function, regular heartbeat, normal weight, mood stabilization, and hormone levels. Take advantage of life-sustaining nutrients from the Earth's oceans with Youngevity's Ocean's Gold. If you'd like to learn more about nutritional supplementation, call your local Youngevity associate, and don't forget to ask about home-based business opportunities.
Hey, if you're like me, your life is hectic. You don't know where you're going to be next. Between kids and family and in-laws and work and traffic and everything else that's driving me crazy right now, my life is insane. I bet your life's insane as well. When do we have time to get every single nutrient we need to be healthy? When? Well, I've got a tip for you. Take a product called Pollen Burst. It's so simple, even I can do it. All you have to do is open the package, pour it in water, mix it up, and bam, you're ready to go. It tastes great. It's not one of those medicine-tasting things. It tastes great, low in calories, helps curb your appetite, gives you natural energy that doesn't let you crash, gives you your vitamins, minerals, nutrients, everything from the plant world. And I got to tell you, for a busy person like me or a busy person like you, we need simple, we need good. Pollen Burst is your answer. Tastes great. Try it, and you'll feel better.
Call your local Youngevity distributor to find out how Pollen Burst can make you feel better. And don't forget to ask about home-based business opportunities. You've listened to physician and veterinarian Dr. Joel Wallach help many people on the Dead Doctors Don't Lie talk radio program. You've also heard hundreds of people tell how Dr. Wallach and Youngevity products have changed their lives. If you're now convinced that Dr. Wallach is onto something and you want to try Youngevity's premium quality products for yourself, we can connect you with a distributor that serves your local area. Simply call our special helpline voicemail at 313-444-3463. That's 313-444-3463. Call right now and leave your name, telephone number, or email address, and we'll see to it that the right person contacts you shortly. Remember, the phone number, 313-444-3463. That's 313-444-3463. Call now to change your life. That's 313-444-3463.
We're back with Dead Doctors Don't Lie on the ZBS Radio Network. Dr. Joel Wallach here for Youngevity, 95 Crusade. We do have lines open. Give us a call toll-free, 1-888-379-2552. Again, that's toll-free, 1-888-379-2552. And if you need to lose that 10, 25, 50, 75, 100 pounds or more, contact your Youngevity associate and ask for the book Hell's Kitchen. The subtitle is The Cause, Prevention, and Cure of Obesity. It also discusses type 2 diabetes and the metabolic syndrome. Get a hold of the book Energy Crisis, learn about the keto diet, and we do have the keto caramel shake and the keto caramel meal replacer bar, and get those calories down, and also you're going to get the high-quality proteins and good fats necessary to effectively use a keto diet. And then, of course, you want one healthy weight loss pack per 100 pounds of body weight, and don't forget that Rev. Put a dropper full under your tongue 30 minutes for each meal, and you'll lose a half a pound to 2 pounds a day, and the magic is you'll never gain the weight back as long as you stay on your nutrients. Oh, That's because being overweight and obese has nothing to do with lack of exercise or eating too much. It is, in fact, a nutritional deficiency of any one of the members of a single class of nutrients. Wow. Okay. Doug, let's go to callers.
Let's head to New Jersey. And Jennifer, you're on with Dr. Wallach.
Oh, Jennifer, you're on the air.
Hi, Dr. Wallach. I'm calling again on the behalf of my mother, Olga Jones. I called before. She's a diabetic. She's on dialysis, and I called before, and you told me to get her the 90 for Life Plus, the Tangerine Beyond, the STO-FX. I got her all of that. I got her the Squeeze It for the blood sugar, the Ultimate Daily Classic, the Selenium. I ordered the Shake Slender FX Vanilla from the 13th of June, and I still haven't gotten that one yet. But
okay, well, stop there for a minute. If you got all your other products and you didn't get that one piece from the 13th of June, I would call customer service immediately. Don't wait. When everything else arrives and a piece is missing, you call customer service right away, and you have them correct the problem. Okay, next question.
Okay, I call them every day, and they give me a different date every time I call them, so I still haven't gotten it yet. But I'm still
Okay, stop. If you're doing that, get the name of somebody, and I'll follow up on it. You get the name of somebody you're talking to. Okay? You get me the name of one of these representatives you're talking to, and I will call them. Okay, next question.
All right. She's having itching in her body, and the blood pressure was very good. I brought her to the doctor. They said it was 138. They asked her what was she doing, but now it's going back a little bit up. She having bathroom issues also. She's still not. She's not peeing right now, and the number 2 is acting up also.
Okay, so she's urinating a lot, and she's having bowel movements a lot. Are they soft or hard?
No. She's not having it. She's not having.
Okay, so she has constipation, and she's not urinating.
No.
Okay, so here we go. What does she weigh? What does your mama weigh?
She weighs about 98 pounds.
Okay, so not quite 100 pounds. Okay. Does she have any other issues? Does she have any skin problems or respiratory problems? Any lung problems or skin issues?
Water in the lungs ever since she started dialysis. But since she's on your product, that's been calming down. That's much better.
Okay, what about the skin?
She's
very dry.
Very dry, and itchy.
Okay, well, hang on. We got to run to those message moments. We'll be back, and Shar and I will give you some suggestions here after these messages.
You're listening to Dead Doctors Don't Lie on the ZBS Radio Network with your host, Dr. Joel Wallach. If you'd like to talk to Dr. Wallach, call us on the priority line, 831-685-1080, toll free, 888-379-2552. You've listened to physician and veterinarian Dr. Joel Wallach help many people on the Dead Doctors Don't Lie talk radio program. You've also heard hundreds of people tell how Dr. Wallach and Youngevity products have changed their lives. If you're now convinced that Dr. Wallach is onto something and you want to try Youngevity's premium quality products for yourself, we can connect you with a distributor that serves your local area. Simply call our special helpline voicemail at 313-444-3463. That's 313-444-3463. Call right now and leave your name, telephone number, or email address, and we'll see to it that the right person contacts you shortly. Remember, the phone number, 313-444-3463. That's 313-444-3463. Call now to change your life. That's 313-444-3463.
Hi, this is Dr. Joel Wallach, your host of Dead Doctors Don't Lie. If you're interested in a colon cleanse, blood cleanse, liver cleanse, in the classical herbal way, you want to ask your Youngevity associate for Herbal Rainforest. Herbal Rainforest has 16 herbs, 16 cleansing herbs, classic cleansing herbs, and 77 plant minerals. That's right, and these are all organic. It doesn't get any better than that. In your busy day, and you're around all these toxins out there in your workplace, on the way home, going to work, in your food, in the air, in the water, you need Herbal Rainforest. I guarantee you, it will give you a cleanse. You can control the dose. It's a liquid. It tastes good. It doesn't get any better than this. A colon that's happy makes you happy. Nothing better than a happy colon. Herbal Rainforest. Clean it out.
For more information on this product or others you've heard about on the Dead Doctors Don't Lie radio program, call your local Longevity associate today. And don't forget to ask about home-based business opportunities.
Greetings, everyone. Judy DeVilbus here. What do you think of when you hear the words tangy tangerine? Well, I think of like a sweet, tangy tasting something. Well, what I'm referring to is the Ultimate Tangy Tangerine. It's a fantastic product. It has everything you need, and a great benefit is it's very, very delicious. It's very easy to drink. I've suggested it even to youngsters. Even children like it. Even little guys. Even little girls. They come right into my office. Their parents can't get them to take those chewables, and besides that, they're not as good as Tangy Tangerine. And I give them a little taste of that, and you know something? They're pleased as punch. So, if it's good for a child and it tastes delicious, why not you? There's no excuse not to take a vitamin when it tastes as good as that does. So how about it? Tangy Tangerine should be the answer to all of your nutritional program problems.
For more information or to order, call your Longevity distributor today. And don't forget to ask about Longevity home-based business opportunities.
This is the ZBS Radio Network.
We're back with Dead Doctors Don't Lie on the ZBS Radio Network. Dr. Joel Wallach here for Longevity 90 for Life Crusade. We do have lines open. Give us a call, toll-free, 1-888-379-2552. Again, that's toll-free, 1-888-379-2552. And if you want to live to be well beyond 100 chronologically, say 110, 120, 130, 140, 150, 160, 170, 180, 190, 200 plus, while being biologically 30, 40, 50, contact your Longevity associates and ask for the books Epigenetics, The Death of the Genetic Theory of Disease Transmission, the book Immortality, and the book Rare Earths and Cures, and learn the secrets to the top 20 longevity cultures on Earth. America ranks 43rd in longevity in the world. There's 42 other countries whose peoples live longer than us. The top 20, their average, they have 100-year-olds. They have 100 over 250 of their population. We Americans only have 1 per 10,000. What are their secrets? Contact your longevity associate. Ask for the book Epigenetics, the book Immortality, and the book Rare Earths and Cures, and find out what it is they're doing. And, of course, the basic thing is they're getting is the 90 essential nutrients. They don't even know it. By dumb luck, they're getting the 90 essential nutrients. We show you how they do it. We show you how you can do it. If you do not do it, your children will be the first generations of Americans who do not live as long as their parents. You must supplement your kids. Okay, Doug, we're going right back to New Jersey. And Jennifer, Shar, are you there?
I'm here.
Okay, well, here's Jennifer. She weighs 98 pounds, right? And she's on dialysis. She's a type 2 diabetic. She has high blood pressure, which she thinks she got under control. Her skin is itching. She gets fluid in her lungs. And so all this stuff is going on here. What do you think is her basic underlying problem?
The itchy and stuff, I would guess she's got a gluten intolerance.
Yeah, because all of these things are nutritional deficiencies. And when you have multiple nutritional deficiencies, the odds are you're not absorbing, even if you're supplementing. And so let's just go over what we would do for this gal. She's about your weight, 98 pounds. Your size. What would you give her as a basic program?
Well, she can eat a lot of eggs and butter and no wheat, barley, rye, and oats. And she has a problem with constipation. The Herbal Rainforest is really good for that. It's gentle, and it should help her.
Okay, Herbal Rainforest. So that would be a, let's see here, a tablespoon at bedtime, which is a half ounce at bedtime with a half a glass of water. And then what would you give her to support healthy blood sugar, healthy blood pressure, healthy lung function, and also when you help healthy cardiovascular stuff, that's also going to improve kidney function, because when you're on kidney dialysis, it means that your arteries carrying the dirty blood into the kidneys are blocked. So what are you going to give her as a supplement program?
Well, she needs Well, basically, I get her on again a healthy brain and heart pack, and that Ultimate Daily Classic and the Sweeties.
Okay, very, very good. Very good. That's actually exactly right. So just again to reiterate what Shar said, one healthy brain and heart pack per month. Go ahead and divide that up. So you're getting a half a dose. Your mom's getting a half a dose of everything at breakfast, the other half at dinner time. Have her take 98 pounds. She could take 2 or 3 of the Sweeties capsules twice a day. That's 2 bottles a month, and that's to support healthy blood sugar and healthy sugar and carbohydrate metabolism at the cellular level. And then, as Shar said, the Ultimate Daily Classic tablets, I'd have her go ahead and take 6 of those a day. It could be 2 at breakfast, 2 at lunch, 2 at dinner, or 3 and 3, whatever's more convenient for her. That's 2 bottles a month of the Ultimate Daily Classic tablets. And they're designed, again, to support healthy blood pressure and healthy blood flows for obstructed arteries. And then, let's see here, the lungs, I would get from Good Herbs, I would have her get the healthy lung support, and that's going to help with the respiration. And if she's not interested in taking any more stuff orally, what would you give her from the Ancient Legacy Aromatherapy Oil Division to help her with breathing and lung issues?
Well, she could try the Raven Syrup.
Yeah, Raven Syrup, perfect. You get an 8 triple plus, dear. And so give us a call in 2 weeks and 4 weeks. We need to know your mom's blood pressure. We need to know her pulse. We need to know her weight. We need to know her blood sugar levels and all that kind of stuff. Let us know also what's going on with her dialysis numbers when they do a blood test at the dialysis lab. We'll be back with Dead Doctors Don't Lie after these messages.
And that does open a line. Call us toll-free, 888-379-2552. You've listened to physician and veterinarian Dr. Joel Wallach help many people on the Dead Doctors Don't Lie talk radio program. You've also heard hundreds of people tell how Dr. Wallach and Youngevity products have changed their lives. If you're now convinced that Dr. Wallach is onto something and you want to try Youngevity's premium quality products for yourself, we can connect you with a distributor that serves your local area. Simply call our special helpline voicemail at 313-444-3463. That's 313-444-3463. Call right now and leave your name, telephone number, or email address, and we'll see to it that the right person contacts you shortly. Remember, the phone number, 313-444-3463. That's 313-444-3463. Call now to change your life. That's 313-444-3463. 3463.
I am Judy DeVilbus. Here I am speaking to you again. I just wanted to tell you that recently I started drinking the Whey Shakes again, the chocolate Whey Shake. And you need to remember, the Whey Shake isn't just for losing weight. It's a fantastic place to get your great protein. And if you're trying to gain weight, you can take it along with your meals. And the best part is, if you want to just have a great protein shake, do like I do. Put it over ice, stir it up, and you can sip on it for 20 minutes to an hour. I do it every single day. I absolutely love it. You need to get back to it, too. It's really good for you. And it makes not fat, but it makes muscle after you work out. And you can also mix it up in a blender with an egg, and you have the most incredible health protein shake. Or mix it with a little water, stir it up, and you have a little pudding. And who doesn't like pudding?
For more information or to order, call your Youngevity distributor today. And don't forget to ask about Youngevity home-based business opportunities.
We're back with Dead Doctors Don't Lie on the ZBS Radio Network. Dr. Joel Wallach here for Youngevity 90 Black Crusade. We do have lines open. Give us a call toll-free, 1-888-379-2552. Again, that's toll-free, 1-888-379-2552. And it's one of those things where we have so many events going on around the world, bad weather, hurricanes, tornadoes, floods, wildfires, earthquakes, mudslides. I mean, you name it. There's things going on. The ocean is dying. All this stuff is going on. And so, and then, of course, our enemies are hacking us. We have probably dozens of countries who are hacking us and trying to bring down our grids for food supplies and utilities and fuel and all that kind of stuff. So I urge you to contact your Youngevity associate and get a hold of the book, which is designed to prepare you. The title of the book is Prepare. It's designed to prepare you for emergencies. And to be prepared for emergency, you have to have everything on hand before the emergency, not look for it after the emergency. So you want to get a hold of the book Prepare. The subtitle is The Prepper's Survival Bible, and it will teach you what you need to have on hand to survive any eventuality. Also, don't forget, we have the 90 essential nutrients. You need a 3 to 4 to 5, 6 month supply for each of the people in your house, and that includes the pets and the dogs and the cats, and all 90 essential nutrients for all vertebrates. And then don't forget the Go Foods, 25-year shelf life, whole meals, gluten-free flours and crackers and cookies and stuff so you can make gluten-free pizza crust and gluten-free pancakes and waffles and so on. But there's whole meals that are freeze-dried, 25-year shelf life. You need this stuff to be prepared. Don't forget the book Prepare. The subtitle is The Prepper's Survival Bible. Okay, Doug, let's go to callers.
Let's head to California, and Mary, you're on with Dr. Wallach.
Well, Mary, you're on the air.
Hi, doctor. I have 2 concerns. I am taking 3 heart and brain body packs, which is appropriate for my body weight. I've been doing this for about a week.
You weigh 300 pounds?
Basically, yes.
Okay. Go ahead.
I believe I have a citrus allergy. I sneeze with bumps, itching with strawberries and oranges. Do you have a product that I can add to help relieve these symptoms?
Maybe. When you have those kinds of things, you want some anti-inflammatory thing, right? And so some of your, quote, allergy, unquote, responses are due to skin problems and some are respiratory problems?
Yes.
Okay. How tall are you?
About 5'10".
Okay. 5'10", and woman, I'd like to see weigh 165, so essentially you need to lose 140 to 150 pounds kind of thing. And so, Charmaine, what would you do for Mary on these issues? She got some respiratory problems and some skin problems. What would you give her in addition to the 3 healthy brain and heart packs, which she's already taking? What would you give her for anti-inflammatory stuff, to reduce all the inflammation from the food she's eating?
She could take the CM Plus internally.
Okay, yeah, I'd go ahead and take 9 of those a day, CM Plus capsules, 3 at breakfast, 3 at lunch, 3 at dinner time. That'll be 3 bottles a month. You get an A plus there. Very good. And then what would you have her put on the skin?
She could put the CM cream on her skin, or for respiratory, she could put Raven Syrup on her skin, too.
There you go. Yeah, Raven Syrup is a great aromatherapy oil. Breath of Life is another great one. And then also, as Char said, you could go ahead and get the CM cream topically on your skin, wherever you're itching and so forth. And again, you want to avoid all the bad stuff. No fried foods, no processed meats, no oils, no gluten. You'll lose weight just by getting on the gluten thing. What would you give her for weight loss?
I'd give her the Rev.
Rev. I'd go ahead and get 2 bottles of Rev per month. These are dropper bottles. Put 2 droppers full of the Rev under your tongue before each meal. It'll be 1 dropper full under your tongue 30 minutes before each meal, a 2nd dropper full under your tongue 15 minutes before the meal, and let it absorb through oral tissues. If you swallow it, it won't hurt you, but you won't get maximum benefit. So you want to let it absorb through oral tissues, 1 dropper full under your tongue 30 minutes before each meal, the 2nd dropper full under your tongue 15 minutes before the meal. It's going to require 2 bottles a month to pull that off. Within 7 to 10 days, you're going to start losing a half a pound to 2 pounds a day. And we deal. In fact, Shar, you know a gal who's 5'3", she came to us, she was 352 pounds, and she's 140 now, okay, in less than 2 years, no exercise, and she was on the same program we're talking about here for Mary, right?
Exactly.
And it's amazing. We see this literally hundreds of times a month. And, of course, the cause of people being overweight is a nutritional deficiency. It is not lack of exercise and eating too much. Okay, it is a nutritional deficiency. And, of course, it wouldn't hurt for you to get the book, Mary, called Hell's Kitchen. The subtitle is The Cause, Prevention, and Cure of Obesity. And you will wind up learning why all this stuff works, and you'll be more likely to be successful. Okay, did you have a second issue?
Yes, and to be clear, I should continue with the tangy tangerine, even though my symptoms are being triggered by it.
Correct. And you've been on it for how long?
Only about a week, but I want to push through, but I just wanted to make sure I should continue.
Yes.
Okay, and my second question is, I take 3 sweeties, breakfast, lunch, dinner, and 2 glucogenics at lunch.
Okay.
And it's still very hard for me not to have sugar or like fruit. I can go about 2.5 hours, and then I almost faint.
Okay, well, here's what you need to do. Okay, stop. So you have reactive hypoglycemia, okay, so you have low blood sugar, you get lightheaded, okay, and so what would you do, Charmaine, to give her something to eat that doesn't have sugar in it?
Well, she can eat eggs.
Yeah, she could have some, say, 2 or 3 scrambled eggs and butter. We actually have a nutrition bar, a food bar, that would help her. It's sugar-free, and it has healthy proteins and healthy fats, and I think it has 251 calories, and you could take a half a bar when you have one of these, feelings like, and if this happens like a half hour, an hour after you eat, you know when it's coming. And so what kind of bar is that, Char?
Keto.
Yeah, the keto caramel bar, okay. And so those are easy to carry with you in your purse or in the car and so forth. They're chocolate. They taste good. And again, I like to eat a half of one for lunch. Sometimes that's my entire lunch. I'll just eat a half of one of those keto caramel bars, and I'll have the other one kind of like, the next day at lunch, and never eat a whole one, okay? And so that's will keep you from getting these low blood sugar episodes. But you're going to have to do all this stuff to lose this weight properly and safely. And then, of course, you want to avoid all the bad stuff to stop all the inflammation and so on. And you're going to be a miracle woman. So you'll take before and after pictures for us. I want your pictures now before you start losing the weight. After 3 months, take pictures. After 6 months, take pictures. After 9 months, take pictures. After a year, take pictures. And we'll get you into the system as one of our testimonies. Okay, Doug, let's go to callers.
Let's head to Alabama. And Selena, you're on with Dr. Wallach.
Well, Selena, you're on the air.
Hello, Dr. Wallach. I have a newborn baby boy, and I'm breastfeeding him now, but I know I'm going to need to supplement soon, and I don't want to supplement with what's out in the stores. What products can I use, longevity products can I use to supplement?
How much do you weigh?
I weigh, I guess about 145 now.
145, okay. How much does the baby weigh?
He was just born, so about 7-8 pounds.
Okay. All right. Now let's see here. Do you have any skin problems, eczema, dermatitis, psoriasis, or any respiratory problems?
No, I don't.
Does the baby have any skin problems or respiratory problems?
Not as far as I know. He's probably a week old.
Well, you'd know if he was wheezing and coughing or had skin problems, you'd know that. Do you have any bowel problems? Any constipation, diarrhea? Do you have your appendix out?
No.
Okay, good. Okay, Charmaine. Selena's 145 pounds. She's breastfeeding. What would you give her as a supplement program is to be good for her and her baby?
I would personally, if it was me, I would get on a healthy brain and heart pack.
Okay. Well, there you go. Healthy brain and heart pack. Divide everything in half. Half a dose of breakfast, half a dose of dinner time. And stay away from the gluten. No fried food, no processed meats, no oils or gluten. Maximize absorption, and also stay away from anything that's going to be inflammatory or have gluten in it. Call us every couple of weeks and let us know how you and baby are doing. We'll be back after these messages.
You're listening to Dead Doctors Don't Lie on the ZBS Radio Network with your host, Dr. Joel Wallach. Imagine a rich, decadent chocolate that's actually good for you. Longevity's Triple Treat chocolate is just that, an antioxidant-rich dark chocolate complete with probiotics to aid in proper digestion. This all-natural product contains no preservatives, and for those with dietary restrictions, it's gluten-free, dairy-free, glycemic-friendly, and kosher certified. Not only does Triple Treat dark chocolate taste fantastic, it contains super antioxidant blueberries to absorb free radicals with an ORAC value of 16,936 per piece. Triple Treat chocolate also contains a proprietary blend of probiotics with over 500 million live healthy bacteria per 8 grams at the time of manufacture. With 80% reaching the intestines, which is much more, than most live culture yogurts. If you'd like to learn more about nutritional supplementation, call your local longevity associate, and don't forget to ask about home-based business opportunities.
Hi everyone, Andy Anderson here. Are you using those handy little bottles of gel that zap germs, bacteria, and other nasties? In today's world, that's smart, especially with all the filthy doorknobs, shopping carts, and handrails we touch every day. Here's what you may not know. Once the alcohol evaporates, goodbye effectiveness. No more protection until you use it again. PureWorks to the rescue. Our FDA-compliant foam, lotion, soap, and spray do not rely on alcohol. Their killing power lasts up to 4 hours. PureWorks disinfecting spray is EPA certified to kill swine flu, bird flu, MRSA, HIV, hepatitis B and C, and a whole host of viruses and bacteria. Mold and fungus too. It's even safe around children and pets. You'll love the soft feel of PureWorks on your hand. It actually conditions and will not dry your skin. Here's a little peace of mind knowing your hands are still germ-free hours later. Get your hands on PureWorks and get PureWorks on your hands. Stand by. Pull out your paper and pencil for your local number to order PureWorks.
You've listened to physician and veterinarian Dr. Joel Wallach help many people on the Dead Doctors Don't Lie talk radio program. You've also heard hundreds of people tell how Dr. Wallach and Longevity products have changed their lives. If you're now convinced that Dr. Wallach is onto something and you want to try Longevity's premium quality products for yourself, we can connect you with a distributor that serves your local area. Simply call our special helpline voicemail at 313-444-3463. That's 313-444-3463. Call right now and leave your name, telephone number, or email address, and we'll see to it that the right person contacts you shortly. Remember, the phone number, 313-444-3463. That's 313-444-3463. Call now to change your life. That's 313-444-3463.
We're back with Dead Doctors Don't Lie on the ZBS Radio Network. Dr. Joel Wallach here for Longevity 95 Crusade. And Doug, let's go to callers.
Let's head to San Jose, California. And Robin, you're on with Dr. Wallach.
So, Robin, you're on the air.
Hi, Dr. Wallach. I'm calling for a gal who's 74 years old, 137 pounds, 5 foot 3.5 inches, and was active, playing golf, bowling, everything up until May. Her only thing is that she had a chronic history of osteopenia. And then she went to bed late May and woke up in extreme, excruciating pain, couldn't lift her arms, just horrible pain. They did all kinds of tests on her and diagnosed her with polymyalgia rheumatica. So she's got horrible pain, trouble falling asleep, some anxiety and muscle cramps, twitching. Her blood pressure got elevated during these episodes, but before that, no blood pressure issues. So she's on a low dose of medication. They put her on prednisone. She's got really dry eyes.
Okay, we only have a moment here, so we got to run with this. And let's see here, 137 pounds, osteopenia, which is early osteoporosis, and then polymyalgia rheumatica. That's kind of like fibromyalgia, it's kind of like lupus. And let's see, pain everywhere. This could be anything from a back problem to whatever, okay? Sleep problems, okay. Charmaine, what would you do for this gal? She's about your weight, 74 pounds.
I get her on a gluten-free diet because that's probably part of her problem.
Okay, gluten-free, yep. No inflammatory foods, no fried foods, no processed meats, no oils, no glutens. And what would you give her, what, a healthy brain and heart pack, did you say?
And extra glucogel.
Okay. One healthy brain and heart pack, and divide it in half at breakfast, half at dinner time. The glucogel, 2 large vials of glucogel, 240 counts, so you can have 15 a day, 5 at breakfast, 5 at lunch, 5 at dinner. Let's see here. Also, what would you give her for pain and inflammation relief?
I would use the CM cream topically, and she can take the CM capsules internally.
Capsules, take 3 of those twice a day. That'll be $2 a month. That's, again, for pain relief and anti-inflammatory. If she has any local pain on a particular joint or muscle or on their neck, anything like that, she can use the CM cream, as Char says. And then, let's see here. What would you do because she doesn't sleep very well?
Well, first, I would take the Sleepy.
Sleepy's very good. Go ahead and take 3 capsules, like 30 minutes before bedtime, and so 1 bottle a month should do. And then what would you give her for blood pressure, which comes and goes? She's on a little bit of medication. What would you do for her high blood pressure?
I would give her the Ultimate Daily Classic. That should
Ultimate Daily
Classic problem.
That will support healthy blood pressure. The goal is to wean her totally off the medication. I'd go ahead and start her out with 1 bottle a month. 1 bottle a month of the Ultimate Daily Classic tablets. She could take 1 at breakfast, 1 at lunch, 1 at dinner time, and then she has to learn how to take her own blood pressure, and she has to learn how to either reduce that medication herself based on her blood pressure or go into the doctor once a week and have the doctor reduce her medication. And that's the goal here. And so this seems pretty straightforward. I know it seems sort of complicated, but we see this all the time when somebody has a gluten problem. It's not unusual to have 4, 5, 6, 8, 10, 12 different diseases. They're on 27 prescription drugs. They're going to 14 specialists. And, of course, they have turned out to be an ATM machine for the medical system. And this is the reason why these pre-existing conditions are so expensive. And this is why America needs us right now, because we have the answer. We know how to reduce the risk of getting these pre-existing conditions, and we know how to support the body's ability to maintain and reverse them, maintain and repair and so forth. And so it's amazing. Shar, how long have you been doing this with me?
Going on 27 years.
27 years. And so let's see here. You don't have a college degree, do you?
Absolutely not.
Okay. Well, the reason I'm asking that, I want people to know that even though this on the surface seems difficult, listen to the CDs, watch the DVDs, read the books, come to the events, and learn and learn and learn and learn. You'll be a tremendous asset to your family. You'll be a tremendous asset to your church family, your work family, your neighbors, and America. Thank you so much, Shar. Super job as usual. Thank you, Doug and Sam. Superlative job as usual. Great testimonies and questions today. God bless each and every one of you. God bless our troops. God bless our Navy SEALs. And God bless America.